Hi, everyone, and welcome to What's the Story Part 2, our second session of our patient-oriented communications workshop series. Today, we're going to be chatting about how to use social media to do public scholarship. And I do see that we do still have a couple of people trickling in, and so while we allow for everyone else to join us, then I will, present a short introduction of myself, of our speakers, and what we are planning to do today. So hi, everyone. I'm Jack. I am your friendly neighborhood comms manager. I've decided that's how I'm going to introduce myself for all of these workshops. I'm really thrilled to be joined by a cast of what I'm calling patient-oriented research all-stars, and I actually don't think that is an exaggeration because we have 4 ChildBright members here today to talk to us about social media and how to use it for patient-oriented research purposes, and they all bring really insightful different perspectives to this question. So I am going to thank Megan, who is manning the slide deck today, and ask her to go to the next slide, please. So today, what you can expect from this session, it's a 1-hour session, and we're going to start off by meeting our panelists and hearing about their relationships to social media use in patient-oriented research. And we're going to save a good amount of time for a panel discussion where we will dig a little bit deeper into some of the topics they'll have time to maybe broach on in their intros, but maybe not get all the way into. And then there will be time saved also for audience questions. So please, if you do have questions that pop up as you are hearing our panelists speak, then note them down. We want to hear from you at the end. Before we get started with all of that, I do want to acknowledge that the ChildBright Network head office is located in Tiohtià:ke, Muniang, also known as Montreal. This is unceded Indigenous territory. And in the spirit of accessibility, I always want to explain when we say unceded territory, we refer to land that has belonged to Indigenous people, never surrendered or acquired by the Crown. My relationship to this land is that I'm born, raised, living here my whole life. I am a white queer settler. I live with ADHD. I'm a writer, I'm an editor, a communications professional. I work in 2 colonial languages, English and French. And I think it's important to specify this, especially in the context of understanding why we do land acknowledgements, why we refer to Indigenous place names, because the renaming of places is part of a historical attempt on the part of settlers and settler governments to sever connections between Indigenous peoples and their cultures and their languages. And so in the context of a communications workshop, a workshop where we talk about language use, the fact that I am a language professional, I think it's important to understand how Indigenous place names have changed over time and how there have been attempted erasures and reclaim them or re-acknowledge them to make sure that they are known and they are celebrated. Next slide, please, Megan. I'm really pleased to welcome our 4 panelists here today, Ray Martin, Stephanie Glegg, Michelle Wan, and Sierra Lynn. And the way I'm going to work for the next portion is I'm going to introduce one speaker at a time. And after introducing that speaker, I'm going to hand the virtual mic over to them for 5 to 6 minutes, and they're going to speak to their relationship to social media and patient-oriented research. Some of them have prepared some slides and case studies on how they've used social media in the past. Some have graphics, and so we're going to get a really well-rounded overview of the different ways that patient-oriented research and social media connect from their different perspectives. So we're going to start with Michelle Wan. Michelle is a family partner with ChildBright. She's a mother of 2 teenage children. Her firstborn daughter received life-saving surgery at birth and is a medically complex patient at the Hospital for Sick Children. Michelle is a member of the Sick Kids Family Advisory Network, serves on the Engagement Council for the ChildBright Network, and is a patient partner with Solutions for Kids in Pain. Professionally, Michelle has worked in the music and media industries After her daughter was born, she just transitioned to healthcare, working in medical education for the Department of Pediatrics at the University of Toronto and for Janssen Canada. She is now self-employed and focusing on projects related to healthcare engagement. Welcome, Stephanie, and I will pass it over to you.
Thank you, Jack. Okay, so in general with social media, I'm not super active, but occasionally I make posts about things that are really meaningful to me. And when I do post, I try to highlight different perspectives than the ones that are being typically discussed. So this is a drawing that my daughter made. I think she was around 13 at the time, and it depicts what it feels like to live with chronic pain. And so Jack mentioned that she was born with medical complexity. She's had multiple surgeries. She has over 50 healthcare providers across 8 specialties. But pain has been the most difficult part of her healthcare journey. And me as a parent, I just feel so helpless when it comes to her pain. We don't know how to talk about the pain because it's such an abstract concept. Doctors tend to use numerical pain scales, which don't really make sense because someone's 2 might be another person's 10. And our healthcare system in general tends to just focus on specific body parts and how they function, and not really about the whole person, their quality of life, and the pain they're experiencing. So I was desperate. My daughter started developing chronic pain at around the age of 11 and 12. And I just wanted to learn everything about pain. I didn't have 17 years to wait for the latest research to be put into practice. So I thought, okay, maybe if I send out a tweet with this drawing, it might get like a thumbs up from someone who maybe was like researching pain, and then maybe I could look up and read about their work. So I made this post in 2022 on Twitter, and this was back when Twitter was more of a popular platform for scientists and healthcare professionals. So when I had 100 followers at the time, like very few. And within a couple of days, this tweet, it got more than 25,000 impressions. It was retweeted by Andre Picard, who's a journalist with the Globe and Mail. And for us personally, we really learned that, wow, like a picture is worth much more than just trying to talk about pain with numbers or with abstract words. And it just seemed to strike a chord with people, with pain researchers, with people who were in pain, and people who were not in pain. So I was like, wow, this really makes people care about pain. Um, we also received messages from about the Canadian Pain Society. There was an art contest, and they said you need to submit this image. So we did, and it ended up winning. And so it was further shared through their platforms through that conference. So as a result of this one tweet that I made, we're now totally embedded into the pain community. We've been asked to speak at health education events. The image is in the U of T curriculum, the rehabilitation curriculum. I've been invited to practice and policy meetings related to pediatric pain management. And even still today, even though it was in 2022, even today, people are still being asked if they can include this image. And the experience really has shaped my healthcare engagement journey. So it was a really positive experience for me. We could go to the next slide. Yeah. So this is around working caregiver. So that's another topic that's near and dear to my heart. So the term working caregiver refers to someone who does paid work, but also who provides unpaid support for a loved one they're caring for, things like going to their healthcare appointments or helping to navigate services. And typically working caregiver discussions, they focus on caring for older adults versus caring for children with disabilities. And in many cases, as was with me, parents who have children with disabilities, they may need to take a leave from work, they might have to quit altogether, or they might be laid off by their employer. In my case, I was laid off while I was on my first mat leave, and then again, immediately following another care leave for my daughter with a different job. And there's a real stigma because of this. There's a real stigma about disclosing whether or not you're a caregiver. And we don't talk about, so it's very negative. So we don't talk about the fact that there's actually amazing skills that can be learned just from being a caregiver. Things like being adaptable to change, problem solving, project management. And then if you do find that flexibility within a workplace, you'd be fiercely loyal to that workplace if they prioritized flexibility for you. So I wanted to put myself into the conversation. So I partnered with 4C Strategy, a designer at this healthcare consulting firm. So we created this image and it outlines some of the assumptions. So it's like an iceberg. So on the surface, even if someone's performing their job well, if there's a caregiver, if they are a working caregiver, they might get pushback when they ask for flexibility or ask to be working remotely. And the skills that I mentioned, which are sort of in the bottom part, they may go unrecognized. So those are displayed under the iceberg. So I posted this about 2 weeks ago on LinkedIn because that's where working discussions are happening. And it received around 2,600 impressions in 2 weeks, almost 100 engagements. So these are reposts, comments, or likes. And I was happy to see that there was likes and engagement from my second and third degree connections, not just people who I knew in my immediate circle. So it's pretty good for LinkedIn. And what was interesting to me was all these sort of side conversations came about as a result of this post. Things like talking about the lack of working caregiver research that's in Canada, gaps in our policies. So there was one comment from a mom. She has a disability herself and she's caring for a child with autism. And her child has to stay home from school due to lack of supports within the school system. And she really kind of outlined this impossible situation where she's in, where from a policy standpoint, if she can care for her son with a disability, that's considered work. And that jeopardizes her ability to receive disability supports herself. But the work that she's doing is unpaid. So, she's just in this impossible situation where she's working for no pay, and I don't even know how she can pay her bills. Other activities that have been a result of this post, I've been asked to contribute feedback related to some of these gaps in caregiving support as part of a partnership between Children's Healthcare Canada and the Canadian Centre for Caregiving Excellence. And then I have been approached by some of those second and third degree connections who are involved in workplace supports, but they're not necessarily connected to the healthcare or disability spaces. So I'm really hoping that by communicating and having further discussions, we can connect those areas between workplace, healthcare, and disability just to broaden that awareness.
Thank you so much for that, Michelle. There are so many threads I want to pull on already in what you've just said, but I'm going to restrain myself to give the opportunity to our other panelists to speak. And so we're going to go next to Sierra Lynn, who is an autistic advocate and communications consultant. Sierra is an artist, a racing fan, and he loves hiking. He has more than 3 years of experience in the social media field, so well positioned to speak to us today, and running online campaigns, as well as a passion for writing and graphic design. He was diagnosed with autism when he was 15 and has gone on a journey of self-discovery while he lived in Montreal, meeting many other autistic peers. He's new to the patient-oriented research community and sees the positive impact it can have. He's proud to be part of the movement to spread the word and help the public understand why it is so important. And Sierra, I will add, is a valued member of Child Rights National Youth Advocacy Council, and so not so new because you've already been making an impact within the ENYAC. Sierra, welcome, and please take it away.
Hey, thank you for that intro, Jacques. So yes, I have a lot of experience in communications, and like any comms student, we learn from Marshall McLuhan that the medium is the message. Uh, it's such a simple but such a good quote, and he said this back when radio and TV were like the biggest forms of media, and how what kind of media you have dictates the messages you can tell. So, what messages can you tell depending on the medium? And what is it like as a user versus a poster? So now we have multiple platforms like Michelle mentioned with Twitter, now X. I hate calling it that, but platforms that started 20 years ago are now starting to face a lot of competition. So, for example, I have here the app starting with Blue Sky, which is a very new platform. launched as a competitor to Twitter, much like Threads. And both of those are just simple discussion forums. And now that both of those platforms have started off as a clean slate, it has given a lot of people room to breathe uh, on online compared to how um, much there might be on X or on LinkedIn. There's also Instagram and TikTok, and those prefer you post vertical videos a lot. Um, Still, photos are really important on Instagram too, and also a lot of these platforms support alt text. So if you have a lot of graphics or a lot of text in your images, you can use that alt text. So platforms are ever changing, some for the worse, others for the better. And the biggest thing is to be adaptable. Don't get so comfortable into one platform. Even I have made that mistake and have been stubborn about going from my old Twitter account to Blue Sky. But the platforms you have are not as big of a deal as the story you're telling or as the research that you're sharing. So it really depends on where and how you want your work and your research results to be seen. So you can choose the platform, and that will help you with how you share the results of your research and anything else to do with your work. And I really believe that having more awareness about your work will help progress the network and the field in general. So the more you share it, the more you'll be able to get the word out about your work and get support for it in return. Next slide. So since uh, social media is a public square and the interactivity of it is really important, there's been a big rebranding of autism and of other disabilities. So, for example, we have the Rainbow Infinity logo there, and that's a huge rebrand from the old puzzle piece logo that used to define a lot of autistic organizations. The puzzle piece was seen as rather juvenile, or could be seen as too generic, or too specific to do with kids organizations. But with the Infinity logo, it's much more mature. It also lends itself to more creative graphic usage compared to a puzzle piece. And it's the same with the disability pride flag uh, that I found in a nice emoji format there. So also the colors with the pride flag are very easy on the eyes and very easy to use in different formats. So the graphics and the captions that you put on social media are really important to catch people's eyes and to also make sure it's in a modern and tasteful look. So, of course, since it's public square, you'll get comments of all sorts. And especially when it comes to research, which is based in fact and objective truth, you can get some reactions from people talking about their subjective truth. And so that their experience of what has been ableist to them can be very different to what you find in research. So it's good to recognize both the subjectivity and the objectivity of both of those. So what people will say in the comments to your research does not negate what you've done in your research, but at the same time, what people say in your comments does not negate what is said in your research. So you'll get a lot of feedback from different people, depending on what kind of platform you choose to post your work on. But I really believe if you explain your research in easy to understand terms, you should get a fair reaction. So make it blunt, make it very plain terms, and you will be able to get a fair reaction in the comments. And of course, disregard any nuisance commenters. They're there. It's the internet. You'll get them. So just disregard it and take everything with a grain of salt there. Next slide, please. So yeah, so this is going beyond POR in a bit. So the steps made with having patients interact with researchers is a big thing, and I think explaining that on social media is super important because I think it's a very new field and not many people with autism even know this is happening. So, uh, being sure that your research can be adaptable and react to the public's comments in this way can be very important. So, what can researchers do to make sure their work progresses along with the public and done in a way that's not reactionary, but still gives recognition to what a lot of commenters want and what the public wants to see out of research? So, I have, for example, here the old um, high to low functioning scale. And for a lot of people, that scale has become outdated. And because it's like you're not just less autistic or more autistic, there is a very big spectrum and all that. So people have chosen to uh, use this circle, and a lot of them do have different degrees of graphs. And this one has five different keys there: language, sensory, perception, etc. I've seen some circle graphs with like 10 different criteria, and that can be quite a bit. So has been a reaction to that very linear scale. And people want to see, especially those going through their own diagnostic pro experience, want to see something like the circle. But I can understand for scientists or for psychiatrists, it might be hard to know exactly where to put a point on that circle, uh, or any measurement whatsoever. So, in the next slide, please. Um, I've made what I can hope is a compromise version, a hybrid of what can be a linear graph, but this one is used from a political spectrum scale, actually. So in those squares from verbal to physical, um, I use a political spectrum scale because that one is very loose in where you can put your points. And I chose generally verbal expression, physical expression, general perception, and general sensory. And those terms, I think a lot can fall into those little buckets. So also with this one, there is no high or low demeanor because I think that label of being either high functioning or low functioning can be uh, a bit tough to explain to people. So for this one, you can put a point on any part of this graph, and I put a rainbow gradient behind it just for looks as well. So I will post this on LinkedIn later today, and hopefully this can be not something exactly like this, but something like this can be a bit of a compromise between the old and the new scales. So thanks for hearing me out.
Thank you so much, Tiara. I'm already seeing parallels between your approach to social media and Michelle's, especially with the use of visuals and the kind of impact those can have. So I'm excited to dig a little bit more into that later. And to hear what happens when you post that on LinkedIn, what kind of response you get. I'll turn it over to Rachel Martins, or Ray, in just a moment now. So Ray is a knowledge broker with the University of Calgary, CanChild, and Kids Brain Health Network. Ray is a disabled advocate and a bereaved parent to a disabled youth. She brings over a decade of experience as a lived experience partner in research. As a knowledge broker in the Family Engagement and Research Training Program, she bridges the gap between families and researchers. She's passionate about public health, health policy, human rights, and disability, and uses her platform as a science communicator to amplify new knowledge and bring it into context for others. So, Ray, I'll turn it over to you now to share a little bit about your connection to social media. Thank you.
Thanks so much, Jack. What I wanted to bring as a theme today was talking a bit about understanding who I am and what I bring to the social media table. And I think part of that can be best explained by well, at first, I would say one of the researchers that I used to work with at Child once said, you know, Ray, you should keep being weird on the internet. It's really working for you. And I thought that's just like the most perfect expression I could have ever gotten, just as a former theater buff, theater nerd. Bringing a little bit of humor to some of these conversations that happen online has definitely helped to share a lot of messages that I do. And the other aspect that I bring to the table was that my start to social media was, of course, being mom to my son, Luke, who was a small concentrated ball of energy for his age. He was born with a really rare chromosome condition called mosaic trisomy 22. He had cerebral palsy and was autistic as well, too. And he was also quite the comedian who felt that he deserved a seat at pretty much any table as well, too. So that's a vibe that I sometimes bring to some conversations as well, too, is just understanding that we might not necessarily know each other now, but eventually you're gonna love me. And that is a part of the conversation that I like to bring in this space as well too, because I'm not the most dynamic communicator. I have my own neurodivergent qualities that sometimes are not the most expressive to some degree. They don't generate what would be considered marketable and popular and things like that, but I still have a message that is worth listening to. And so to understand some of the qualities that I bring to the table is something that you can also consider as well too as a thought exercise when you consider what sort of space you want to generate within social media. Next slide. So, of course, being Luke's mom offered an opportunity to start off with to contemplate the idea of science communication and my interest in it through the skeptics movement, which was kind of starting around the era of misinformation around Jenny McCarthy, but then also there was a number of other influencers as well too who were really kind of in that time frame that were becoming more popular and sometimes being picked up by mainstream media sources as well too, despite the fact that there was no information to support what their claims were. So I became really interested in the idea of debunking, specifically within the disability community as well too, because families become so very much at risk for a variety of claims that are brought up on the internet. So leveraging my skill sets that came with better understanding the research world and being able to make information more digestible and to bring it in context within the family setting offered me opportunity to have conversations more on a mentorship level, one-on-one, and offer people those skill sets along the way as well too. And that in and of itself was knowledge and mentorship, which kind of inspired the idea of, hey, I could probably do this knowledge mobilization thing as a career one day. I didn't think about it at the time, but I think about that in retrospect now. And I kind of got myself set up for doing this in the future. Next slide. And so my first offering to being a partner in research was actually with this particular paper, which generated a Facebook group called Parents Partnering in Research, which even 10 years later still existed. And y'all are welcome to come as well too. It's Parents Partnering in Research. I'm happy to put that in the chat as well too. But this is an opportunity for people to disseminate their work within the parenting community, who parents of disabled children. It's an opportunity for conversations to engage parents and ask questions about things you might be writing in your grant and things like that. And within that, to have challenging conversations as well too in an isolated way. But what became as well too was an open door to people where it's not like you have office hours for the general public to come into your space and go, hey, I have a question about this thing that you're doing. Let me, can you answer that for me? This became that quiet, private space without bringing too much concern because the conversations only got to a certain point where it wasn't like ethically ambiguous or anything like that, where you can develop longer term relationships and better understand what families are going through. And it's an opportunity to have conversations, understand people better, especially parents, beyond the 1 hour clinic appointment. And so a lot of researchers began to understand just some of the nuances and the challenges that families face as well too. Next slide. And as this process evolves, part of my job as a knowledge broker with the family engagement program is to think about what people are talking about, where their interests lie, and what would be beneficial to support them along the way. Because we do see this evolving where there is this theme resonating theme of coexistence, where we are in everybody's respective spheres. Lived experience individuals are in the sphere of researchers and vice versa. And this is a really great example of that from a paper that was written about a Stanford MedX conference, where they took tweets that were live tweeting for a conference that one year from parents, or sorry, patients and physicians and other people, other staff as well too. And they looked at kind of the varying levels of engagement in that capacity. And what was so interesting about that was you can see from the red, which represents patients, is that they do carry their own in this space. And they do have something to say here and are quite passionate about the subjects that they bring to the table. And so as we evolve, I'm offered space to bring more information, to listen to what their needs are, to perhaps consider how to build new strategies in that way, but also to address important subjects in research in real time and help bring them into context as well too. And how I do that from my own personal, my personality, but then also with the information at hand, is to simplify it in ways that are more digestible for social media platforms. One example was I'm a Mennonite dancing on TikTok to a song from Chicago that says, "But I can't do it alone." And it talks about the process of patient-oriented research in 3 minutes or less, but understanding that we do this together. To my shock and surprise, that was shared at some higher levels at the CIHR, to which I was delighted and horrified. I am not the best answer, but at the same time, it was enough to bring that point across in the most concise manner possible. So to bring who you are, no matter whether or not you're a person with lived experience in this world or as a researcher, is an important theme to consider as you figure out what space you want to engage in.
Mm. Thank you for that, Ray. And if you do feel comfortable sharing that link in the chat, I would love to see that video. And I feel like that is such a fantastic example of the ways in which what we post online can have more impact and more reach than we can ever imagine. Sometimes much to our horror, right? But hopefully to our pleasant surprise. Last but certainly not least, I want to invite Stephanie Glegg to the virtual floor. So Stephanie Glegg is an assistant professor at UBC. She's also the Child Bright Knowledge Mobilization Program co-lead. Stephanie Glegg is also a pediatric occupational therapist. And as an implementation scientist, she studies the best ways to move knowledge into action to improve healthcare, health outcomes, and health systems. Outside of work, she spends time at the rink cheering on her kids' hockey pursuits and cuddling with her dog, Rollo. Stephanie, I'll turn it over to you.
Here's a photo of Rollo, just to get things started in a good way.
So important.
She's caramel sweet with the chocolatey coating. That's how she got her name. Anyway, back to the content. So I guess I used to be very active on social media. I'm less so now. I'll talk about some of the reasons for that. But I started out on Twitter and I used it for professional reasons. So as a researcher, as a clinician, as an advocate, bit of an earlier adopter. I was also a knowledge broker, but supporting clinicians to access and apply evidence to their practice. And I supported others to learn how to use Twitter, particularly as a KM tool at conferences. So live tweeting conference key messages, which was a really good way to make things more accessible to people that weren't at the conferences, to highlight key current issues or discussions in the field, and then also to document the key messages for action that we could take back to the health center and then apply. So kind of your own note-taking in real time. I also used it to share research or resources that we developed at Sunny Hill. And some of the outcomes of that were positive in terms of, for instance, Altmetrics is a social media engagement indicator, and it's been helpful in demonstrating the reach and potential impact of some of my work. For funders, for academic performance reviews, or even as an outcome measure for implementation or program evaluation work. I think one of the keys is to have a call to action to augment engagement when you're posting. But I also learned from others on Twitter. So I followed key reputable researchers that were in my field. And yes, well, that created a bit of an echo chamber. I knew I wanted to hear from those individuals, and I sought out other voices and evidence and perspectives, from other sources, especially at the beginning of the platform when not everyone was on there. At conferences, it was also really helpful for networking, especially as an early adopter. I would post things, I would see other people post things, and I would recognize them at the conference from their tweets or their profile picture. And that helped me with networking, especially as I entered the conference domain. I'm an introvert, and so it just made this connection. Oh, I saw that thing you tweeted, that was great. And it opens the conversation. In another domain of my life, I'm a musician, and so I use Twitter to promote our gigs, share song releases, and then network with people in the industry. So I had a separate account for that. And I also joined Instagram, but I always forget to take pictures, so it wasn't very useful for me. I recently archived my Twitter account, though, in response to some of the harm that the platforms caused to people in my network, including trainees in our department. And like Sierra, I moved to Blue Sky. I took a long pause, and I'm having to rebuild my network, but I think I'm ready to conceive that it's a worthwhile investment. For Facebook, I use it for personal reasons. So as a parent of a child with neurodiversity, apart from just like connecting with friends, I went to family groups to learn, especially after a diagnosis, how they navigated the system or things to get started, learning about their experiences with different interventions, so I could understand from their perspectives how well they might meld with our family's values. And then as a researcher who's also a parent and a clinician, like I have a friendship network of clinicians and parents. So on occasion, I'll raise awareness of new studies that might be of interest to those groups. It can help to engage research partners or participants, or sharing studies that other folks in my network are doing that are doing good work, to help them with recruitment, and then also getting feedback on research questions to pursue. So like with the group that Ray mentioned, great one, lots of folks with great perspectives, helping to refine where research directions go and give feedback and stuff. Politically, not very fond of being on the Meta network, so I'm also reconsidering Facebook and Instagram, but at this moment I'm on them. And then finally, I use LinkedIn just for professional use. I highlight articles that my team's published. It's also a nice way to build a network because it's a place to house connections. If you've met someone in person, you can connect to them on LinkedIn and then remember that you've connected with them and have a way to contact them later, especially if you're changing organizations and you lose access to your email. And even if you never reconnect, their connections might see your connection, and it could lead to a nice collaboration or partnership in the future.
Thank you for that, Stephanie. And that is, I feel like your comments are a wonderful segue into a couple of questions that I wanted to ask to launch the discussion portion of this session. And so Megan, maybe we can stop sharing the presentation temporarily, just so everyone has the opportunity to see each other if you have video on. And, I've been thinking just in response to some threads that I can pull on from many of your presentations, thinking a little bit about how the landscape of social media is really evolving quite rapidly in 2024 and 2025. Stephanie, you mentioned moving off of X and towards Blue Sky, moving away from Meta. Michelle, you posted this recent infographic 2 weeks ago about working caregivers on LinkedIn, and you saw quite an impact there. And so I'm curious to hear from your perspective, how are you responding to this evolving social media landscape, and what should the lesson learned be for patient-oriented research community online? And that's a question to everyone. Perhaps Stephanie, since you were speaking most recently, I can pass it to you first, but I do want to hear from all of our panelists.
Sure. I mean, the first thing I'll say is that I value diverse voices. But when they are harmful, it is difficult, challenging for everyone involved. Just a couple of examples. So there's a student in one of my colleagues' research labs who is I guess, Palestinian. And so the conflict in the Middle East was having big impacts on her, and the messaging that was coming through on X was very harmful for her. And her supervisor was using Twitter for the lab account, and it was sort of endorsing what was happening. And so they had a discussion as a lab group, and then decided after that discussion collectively to shift to a different platform and close that account because they didn't want to be a part of that. And then there's a lot of misinformation and disinformation, and it's becoming harder and harder to weed that out and find the good things and take a critical lens to know when you're consuming content about what is reliable and accurate. And part of it relates to the group of people, or the majority, or even the algorithm in what comes up in your feed. And so that's another reason why I left Twitter. But another thing to consider, regardless of what platform you're on, is there are benefits, but there's also potential harms. So my twin is trans, identifies as gender non-conforming, and they've had many barrages of death threats and abusive responses to their posts, but also public appearances when they're advocating for human rights, including trans rights. And so there's a really real risk of harm. Some people choose to only put one thing forward. So I explained how on Twitter, I use my research professional lens, or clinician, and that is what I put forward there. Because of the purpose of why I'm there is around that and connecting to evidence, sharing evidence and things like that. And so advocacy, I'm careful about what I choose to do, which has its drawbacks, but also its benefits. And so if you're in a group or whatever, I just think like thinking about the safety of yourself and those of your loved ones is a real consideration for many people. And it's been heightened by recent political shifts, especially in the US. And so I would love for it to be a brave space. And sometimes it's not. So also accessing outside supports. If you're experiencing those things, you're not alone. There's so many people experiencing these things. So reach out for help if you need.
Michelle, I saw that you unmuted yourself. Did you want to jump into the conversation?
Yeah, I just wanted to add, I agree a lot with Stephanie. So for me, I feel like I don't use Twitter X anymore as much, just because of it's gone kind of crazy, and not a lot of people are on there anymore. I'm considering maybe starting at Blue Sky, but I'm not ready for it yet. But really, if your name is attached to it, you sort of have to, it's like you have to have a stance on something if you're going to say something, but then you're more at risk for having these dangerous reactions, or if people don't agree with you. So I have to be very careful about what stance and how I want to be perceived. On Facebook, I am part of Ray's group that she mentioned, but I use a different name. So because that's more, so I use a completely different name. People who know me personally, they know that name. So I'm with friends with them on Facebook, but when I go into those private groups, there's one layer of protection, and I feel a little bit safer that I can engage in some of those conversations because I'm under another name. It's also for my daughter's privacy. I don't want to be saying all this stuff about her without her knowing. Like anything I post has to have her permission. And then for things like TikTok, I know Corinne mentioned something about dealing with information overload. So I tend to stay away. I don't post anything on TikTok or Instagram because I find like those ones will consume you, and you're you're just scrolling and scrolling and scrolling, and they just have all these reels. So then you can get into this sort of trance of like consuming all this content, and it's very overloading sometimes, and you don't know what's real and what's not. So just being conscious of that.
And Ray, I see you have your hand up. For those who are posting questions in the chat, please continue to do so. I'm keeping an eye on that, and we can discuss those in just a moment. But Ray, please.
I'm really appreciating this conversation for so many reasons, and I think I do agree as well too with the idea of it's really dependent on your comfort level in terms of where you sit, where you engage, and how you engage as well too. I am somebody who has a tremendous amount of comfort in uncomfortable spaces. It's probably why I love doing what I do. But I just wanted to encourage one aspect of this as well too, is that to tease some context out of some people's how they understand how they react and why they react a certain way. There are people who are clearly like, who just, block. There's a reason there's a block button, and, do that and do it liberally in as many ways as you can. But then also too, there are people who within the disability community, once they hear information, they just want somebody to listen as they shout into the social media world, the pain that they're in. And I think that that's a really important consideration to have here, and to use that as a gauge in terms of some of the reactions that you may get from people who you might not necessarily be familiar with. And then another aspect as well too is that aspect of safety. I, for a number of personal reasons and professional reasons, keep very tight fit on some of the things that I'm willing to share, because there is a very kind of an escalated danger level in some aspects as well too. So I really am mindful in that way in terms of how to protect myself, but also with my health as well too. There is a need to consider how much I'm willing to add to that. The more stress, the more anxiety I put, the more symptomatic I am. So I need to pick my battles. I need to think about the things that are achievable with how I'm feeling in the moment as well too. So it takes a lot to consider, but also just that there is nuance to reaction, I think, is what I want to say. Because also, and just last point is, we have gotten into this discourse online that it's us against them in terms of like a variety of different subjects. And with that binary thinking, you have people who align with clubs or communities in that way. And sometimes there is opportunity and space to think about encouraging people to think a little deeper beyond that binary thinking, and to talk about things like methodology, to think about context, to think about how that fits within the framework of people's lives. And because you have people, and I really encourage people to read this book, oh my gosh, and Amanda Ripley, Amanda Ripley has a book about arguments, about how we argue, why we argue, and things like that. And there are people in this world that are conflict entrepreneurs. And that's where they come from, this idea of binary thinking, is that when you do that, you simplify things in a way that feels nuanced, but the same reality, that's where misinformation comes into that space. So when you tease that out and bring more context, people understand a little bit more. This is a bit more complicated than what I imagined this to be. And that becomes another platform on which you can communicate to a deeper degree. But even then, not everybody has time for that as well too. So there's just a lot of considerations to be made in that space.
I'm hearing a lot of important considerations here around being able to draw personal, professional boundaries around social media use for patient-oriented research. And Sierra, I'm going to go to you next. And since I saw a question for you also in the chat, maybe you'll allow me to fold in this question from Corinne about which social media platforms are youth research partners using right now to access research results. And so thinking about the evolving landscape of social media this year and how you're responding to it, Sierra, I think it would also be great to hear, what platforms are you using? What is making sense for you and for other youth?
Okay, yeah, I didn't see Corinne's comment actually. Thanks for highlighting that. And also, they kind of adds on to Alex's question about what social media you all use for research news, because I'm actually curious about that too. Because from my experience, I don't feel like my work is finished until I post about it. And I'm wondering if there would be the same mentality among researchers, because I can imagine you just publish your abstract or your results, and that's kind of the end of it. But then it's like that's not publicly accessible. So I I try to find the most I can via LinkedIn. Um, Very rarely would I use Instagram or something more, something like that for like legit research news. Um, because also like with Alex's question, um, about like what you can use for research news, um, would there be uh like an incentive for researchers to post their results and to put it in like an easy to digest way in social media? Because I feel like if that's done a lot more as a norm, then also people who are just taking in research news who aren't in the research world themselves will actually feel involved in it, because I feel like that's why there's so much debate online of what should be official and what shouldn't. And that's why on social media we're kind of rebranding that stuff a lot. So I think it would bring a lot of legitimacy to those discussions online if all of you did like post more about your work online and what the results of your research mean for those in the public sphere.
Hmm.
Uh,
So I'm hearing, Sierra, that you do see a clear power of social media and clear potential impact for researchers sharing online. And I'll go to Stephanie next, because maybe Stephanie, you could speak to knowledge mobilization and how this is a tool that we can use to mobilize evidence-based information about disability, among other things. And then I'll go to Rhaenyra.
Yeah, so just with my KM program co-lead hat on, and also as a researcher, like that's one of the key uses that I use Twitter for, and that I plan to get back to with Blue Sky, where I had this network of people in implementation science, in child health, in etc. that and they follow me because I share some of those key messages for action. So I also feel just like you, Sierra, that work's not done until the message gets out in some other way than a journal article, because it's behind a paywall. It's often written in an inaccessible way. And who are the people that you want to reach? Like, yes, you want to reach researchers so that they don't duplicate the work or they could build on it. You want to reach the key people who will benefit from or be impacted by the research. And while social media is passive, you're pushing information out there. You don't expect people to change their behavior from that strategy, but you can increase their awareness, you can increase their knowledge, their curiosity, a connection with them that can lead to something else. And so it is an effective way to do those aspects. And someone put in the chat, infographics, visuals, like calls to action that link to a plain language summary, that link to a resource or tool that you've created as part of your research that someone else could apply or adapt. All those things are really helpful and part of the KM piece.
Rhaenyra, I'll go to you for a final word before we wrap things up.
Sure, thank you. I'm a random person and I get the final word. That's pretty interesting. For those who don't know me, I'm Rhaenyra. I'm a storyteller and I'm the Knowledge Translation Program Manager at Sick Kids. I just wanted to bring up, and this really relates to what Stephanie just said, the importance of evaluation, right? We want to reach people, but what happens when we do reach them? And just how incredibly important it is that we collect that data and we share it with other people. Like today, I think I heard a couple of you, it might have been Michelle who mentioned something along the lines of being invited to policy tables. And I think Ray might have also alluded to opportunities like that. If we do not capture that information and share it, we don't know what the value of sharing on social media is, right? We talked about some of the harms. It can be emotional. We're putting ourselves out there. It can be potentially embarrassing. Also, I don't know about you, but I've spent tons of time developing something that I think is really great, and I put it out there and I get like 5 likes. I'm like, what? That's it? Right? I put my heart into this thing. And so I think just in general, we need to be mindful of our knowledge translation goals. What are we trying to accomplish, and how do we know that we're accomplishing that? What do people do? Because I like things all the time, but it doesn't mean that I've really absorbed that thing. It doesn't mean that I take the next step. So how do we make sure that people are doing that, and what is the next step?
Rhaenyra, I don't regret at all passing the virtual mic to you, because this is an element that came up in our discussions before this session with the other panelists, the question of impact and how to measure your success on social media. So I'm glad that you were able to throw that reflection out there for further consideration. And ideally, we could continue this conversation on social media, since we're already running out of time. So Megan, if you want to just throw that screen up one more time. I will flag that the last session in this series is now scheduled for March 24th, and it is now open for registration. So please do join us again for a discussion on how to talk to the media about patient-oriented research. And so we're taking yet another lens to this question of what's the story in patient-oriented communications. And Megan, if you go to the last slide, I do believe that we have all our social media platforms, so on Facebook, on X, and on LinkedIn. So please do join us there, and we can continue this wonderful conversation. I will say thank you so much to our 4 panelists and to the audience for participating so actively. The chat has been blowing up. So we really only scratched the surface of this question of, how do we use social media for POR? But for me, the takeaway is that there is real power and real potential there. It continues to develop, and so maybe not without its concerns or without its questions to navigate, but there is a lot of promise there. Pierre, I'll turn it over to you now for the actual final last word.
Thank you, Jack. We just keep going until everyone has the last word. Yeah, again, thank you everyone for joining. Just a quick note before we all log off. I will add it, I guess I won't share the slide, I'll just add it in the chat. Just 2 quick things to take note of. We have a feedback survey if you wanted to let us know how today's session went, and ideally identify any further topics you would like to see us explore. But for any folks who are joining us from Childbright today, just a quick reminder that if you haven't signed up, we do have our informal networking event set for next week. So that is in the chat as well. And if you have any questions, feel free to reach out, and we can gladly connect and follow up via email. Thank you so much for joining, and I hope you all have a fantastic rest of your days.
Thank you, everyone. Take care.
Bye-bye.